Hi, I'm Southampton Town Supervisor Jay Schneiderman, and welcome to Talk of the Town, where we take a close look at issues facing our community. Today we're going to talk about a big problem caused by a little creature, the tick. Not just one problem, but many health issues that are in this category of tick-borne illnesses. And as it warms up and people head out into the woods or even into their backyards, we are concerned about these illnesses that are carried by ticks. And I'm joined today by Rebecca Young from the Disease Resource Center, Stony Brook, Southampton.
Regional Tick-Borne Disease Resource Center.
The Regional Tick-Borne Disease Resource Center at Southampton Hospital.
My office is in Southampton Hospital. Of course, we're together with Stony Brook.
And we have Councilman Tommy John Schiavone, who has been working very closely on these and other health-related issues. So thank you for joining us. So Rebecca, we'll start with you. I know this resource center, this tick-borne disease resource center is relatively new. A few years ago it was started.
I've been working there just about 4 years.
Okay, tell us what's there and how you got involved.
I operate the hotline. We call it the helpline, but the hotline for people who have problems. Either, it can be a problem like I have a tick on me. What do I do? Or what's the protocol? Or it can be people who say I've been sick for 10 years and I don't know what to do. I've seen 15 doctors. So in the winter months, I get a lot more of the chronic or what we call persistent Lyme disease now. And in the summer, of course, the bulk of calls goes way up, and there's a lot of acute. What do I do with a tick? How do I get tested? What medicine should I use? Because there's so much different information out there. In the last 2 weeks, I've just started getting calls from people who are getting ticks embedded in them.
Already, so this, I know in the winter it's less, right?
Yeah.
But in the spring they all come out, and at this point of the year they're very tiny, right? Are they the nymphs?
Yeah, a lot of deer nymphs out there right now. There's the Lone Star adult ticks are also out there. They're very there's a lot of them. The nymphs are going into the spring and into the beginning of the summer, and they are the ones that are in some ways the most dangerous because you don't notice when they're on you. They're like the size of a poppy seed, and you might just, and then you don't realize that you've been inoculated, and you don't watch for signs and symptoms, and you kind of lose track of it. Whereas if you have an engorged male or female tick, you see it, you pull it off, you freak out, you call me, you go get medicine,
So the
that's
nymphs,
the reason.
do they eventually get engorged?
They do get engorged, yeah. Of course, they're not to the size of an adult deer tick that, say, fed for 2 weeks would be pretty big.
Okay. But you might just think it's a little nothing, right?
Yeah. Oh, yeah. Yeah. They go unnoticed.
Wow.
Yeah. And when you pull them off, you can actually, they're large enough that you can see that it's a tick if you have good eyesight, depending on your age.
Sure. So now, what if you were inoculated with, I guess, Lyme's disease, in this case, Lyme disease, what type of symptoms might you start to notice?
Well, in the first day, you're not going to notice anything. You might have a little itching, a little red welt, and that's from the saliva of the tick. It has an irritant in it, but that's a local irritant. In 3 to 30 days, you could develop what they call a bullseye rash, and that is only 50% of the people. If you get the bullseye rash, that's a good thing because that tells us definitively that you have Lyme, and then we give you the 21 days of doxycycline, and we are very good at curing Lyme in the first stage, which is like the first month. The problem is if you don't get the rash, and then you don't get any other symptoms, you might go for a while without, I'm not that sick, I'm fine. And then you don't get treated for a long time, and then Lyme disease becomes harder to treat.
Well, what type of symptoms might you start to see? Let's say you didn't get the bullseye rash.
Okay.
You might not even known that you had that initial bite.
Yeah.
So what type of symptoms might you start to see that might cause you to go see a doctor?
Usually like in 4 weeks, you could, like if it's in the middle of the summer and all of a sudden you have a flu, that's a little weird. That would be a sign that you have tick disease. It's generally aches and pains, headache. You have different stages. As you get into the second and third month, you run the risk of cardiac involvement, such as what they call a Lyme carditis. That's a possibility. Also, neuro symptoms, which some doctors believe can start right at the beginning, but many believe it's not until 2 or 3 months after the bite, and that would be what many people describe as cognitive fog, headaches, tingling in the arm, not feeling well. And then in the final stages, which is anytime after 2 months, you could develop a very bad arthritis, a Lyme arthritis. That could be slight, or it could be to the point of crippling.
Now, at that point, now you were 2 months in.
Yeah.
Again, they would prescribe an antibiotic. Is that?
Yeah, yeah. As soon as they think you have Lyme disease, they will start you off with 21 days of doxycycline. The problem is if they don't know that your symptoms aren't bad enough, and so then comes the test. And there's a lot of controversy over the test. It's a 2-tiered test. It's an antibody test. It tests your body's reaction to the spirochete or bacteria. It doesn't test for the bacteria. So there's a lot of room for false positives and negatives. And so the diagnosis of Lyme is the combination of the blood test together with the clinical picture. So if you have no clinical picture, that would be a tough one, because you could conceivably have Lyme disease for a while, going untreated, and then suddenly get very sick. That's possible.
Now, do we know how many East End residents have been impacted, affected by Lyme's disease?
Well, it's just been announced that it is an epidemic out here. That was in the meeting that we had yesterday. They announced that it is an
They
epidemic.
are calling it an epidemic.
Yeah,
At the
now they
county
are.
level or at the federal level or state level?
At the county level, I think,
Okay.
Not the state level. I don't, you could
So,
correct
John,
me
were
if
you
I'm
at-
wrong. You might know you were
Sure.
there.
At the New York State Committee, Crisis Committee on Tick-Borne Diseases, Senator LaValle did call it an epidemic, and they were referring to tick-borne diseases in New York State as an epidemic.
Well, that's significant, because if I remember from my county years, if the state calls it an epidemic, it then the money that you spend to address that epidemic is largely reimbursable. So there ought to then be state money to help us deal with this problem if the state is recognizing it as an epidemic. Lots of people call it an epidemic, but it hadn't been, the state hadn't designated it as such. So we should make sure that.
That's right. The senator was speaking to Dr. Zucker, the head of the New York State Health Department, and I think the senators want the health department to declare this an epidemic.
Declare it an
for
epidemic,
that very
to
reason,
make that
probably. Yeah.
funding source available. Now, I know, Tommy John, you've been particularly interested and concerned about tick-borne illnesses.
Yes.
So, yeah, talk a little bit about what your concerns are.
Well, I was raised in the village of North Haven, and members of my family have had tick-borne diseases. I've had tick-borne diseases. I am a former trustee of the village of North Haven, and that was in part, part of the reason why I got into public service in this particular area. I am very curious about what has happened on the east end of Long Island over the past 50 years that has brought us to where we are today. The Tick-Borne Resource Center does an excellent job at education and health and wellness. I'm interested in the ecological changes on the South Fork or the east end of Long Island, which has made tick-borne diseases particularly dangerous to us. So,
More prevalent.
yeah, and the numbers of ticks seem to have gone up, and I do believe that government has a role in this, and I know Suffolk County, through their health department, they are taking steps to measure and control this, as is the state of New York. So, I think that this is the long view. In other words, we need to get our tick numbers down, and I believe that would alleviate some of the need for some of the medical treatments and interventions.
Do you have any ideas about how to reduce the population of ticks out there?
That's a good question. And you know what? I believe in science, and I believe that we really need to apply some studies to this, and there are many.
You're serving on there's a county task force, right?
Yes, I am.
That's working on this issue as well. So, yeah. So what are some of the thoughts for reducing tick population?
Well, first of all, we need some baseline data, and that is what the Suffolk County Health Department is doing, is measuring what we have and where the tick populations are located. They have testing sites in each one of the 10 towns in the county, and so I think that is important. They're very difficult to get rid of because, you know, they're everywhere and nowhere at the same time. You know, it's interesting. And as far as the ecological reasons why these numbers are the way they are, it hasn't been proven scientifically yet. Now, there's some interesting research from an institute on the Hudson River called the Carey Institute. They are doing a study of applications of human interventions in the environment to reduce tick-borne illnesses in humans. Now, we know there's plenty of applications to kill ticks, but unfortunately, they kill a lot of other things as well. And so we really need to be careful, you know, of what we are doing with what we're doing to the environment. Now, this particular study is a 5-year double-blind study, and it's in Dutchess County. It's going to cost $8 million, and it's run by the Carey Institute, and what they are doing is they are treating the white-footed mice, and they are spraying an insecticide. It's a bioinsecticide, which a naturally occurring fungus that gets into the tick and kills them. They are treating entire neighborhoods, which is different than other studies. Other studies were treating particular parcels. These are treating neighborhoods. And in some neighborhoods, they're using both applications. Other neighborhoods, they're using just the bait boxes. And then in other neighborhoods, they're using the fungus. And then there are controlled neighborhoods where they're not applying, they're using placebos. So I'm looking forward to the results from this. And they are measuring the effectiveness of those applications on actual human health. Like, what's the causation between the applications and how many people are getting tick-borne diseases?
And when do you
And
think
there's also the issue of how many of these ticks are infected. And the reservoir for the disease is in the whitefoot mouse. So that's another way of trying to control the disease, not necessarily the ticks, but there is something that came out of MIT, which you probably know about, which is the genetic altering of the whitefoot mouse so that it becomes immune to the disease. You know, I mean, and that's one of the very way out there, but you know, they're talking about that. They're going to try it out on an island. So that's another issue.
Ticks are hatched without tick-borne illnesses. They acquire them in their first blood meal in the larvae stage when they attach for their first blood meal onto a small mammal. That's when they become infected.
Because they're sterile when they hatch out of the egg. They're sterile. They have no disease.
So we hear so much about the role of deer in all of this with Lyme's disease, but now we're talking about white-footed mouse.
Well, there's the host, which is the deer, and there's the reservoir, which is the mouse. The mouse is where they get the bacteria. The deer, by and large, is a host. It is transportation. They mate on the deer, and they travel around on the deer. And the Lone Star tick, by the way, not to get too far afield, but the Lone Star tick, which carries ehrlichiosis, the reservoir for that tick is the deer, actually. They get the disease from the deer. But so it's a host versus a reservoir. You know, in the 2-year cycle of the tick, if you get rid of any part of the chain, you get rid of all the deer or you get rid of all the white-footed mouse. I mean, you know, all these are different ways
now,
of trying to...
have we seen, I know we always talk about the increase in deer population, have we seen an increase in rodent population?
Yeah, actually, you know, which is our habitat disruption has gotten rid of a lot of the mid-sized animals that would feed on these rodents, these white-footed mouse. So they're gone. Even animals like the last time there was a rattlesnake out here was in 1960.
I hear the eagles are coming back though. So maybe the
yeah,
eagles
the little foxes, but they're not enough to take care.
A few more eagles
Yeah.
will catch the mice and the Lyme's disease will go down.
The foxes would, but there's not enough of them. And then there's bumper crops of acorns.
So we have to bring
that
back
are
foxes.
feeding these rodents, so they have no predator. They've got endless store of food, plus the habitat disruption, you know, has made a big difference. You were asking why it's so bad here on Long Island, and that's one of the, the farmland going way back with.
What we're doing as humans is we're fragmenting our forests, right? We have houses, we have farms, we have roads, and it makes it more difficult for predators and larger mammals to live in those fragmented forests, and it makes it easier for species like white-footed mice and chipmunks to live. Yeah.
species that don't go very far. They
Right,
stay in the same
and they're
area.
one of the
Plenty to
host
eat.
reservoirs of a lot of these diseases that we're worried about. And not only that, deer, you mentioned deer, they live quite well among humans. In fact, you know, the deer population has gone up with the advent of humans. We've taken out their predators. We're probably not going to bring in packs of gray wolves, so that's really kind of off the table, and that is a bit of a joke.
Right.
That would do it.
But
No.
you know, that's really what was
Right, the
here,
biggest,
and-
That's right.
yeah,
Yeah.
the threats
That's
to
right.
deer are either famine, hunters, or cars,
Yeah. Right.
basically.
Yeah.
And they don't
Exactly.
seem to be starving to death. They have plenty of landscaping to eat.
Right, and so
apparently.
the key piece with the deer is what you said. They are an excellent blood meal for a female adult tick, and she, you know, they mate on the deer, and then she drops off and has anywhere from 3,000 to 5,000 eggs. So they are part of the 2-year cycle. And ticks, by the way, they need 3 blood meals in their life, and that is the final blood meal, and it's a
Right.
healthy one.
Yeah,
too.
and they lay eggs and then they die.
Now, sometimes you hear hunting being proposed as a, not necessarily a solution, but a way of reducing Lyme's disease or some of the other
Getting rid
ehrlichia-
of the deer,
Right,
cutting the deer you're talking about.
right.
Yeah,
Is
that's.
that an effective strategy, or should that be part of a strategy? Or?
Well, you probably can answer that better, but when the deer population goes down, so does the incidence of tick disease in terms of the studies that
Now,
I've read.
Shelter Island, though, tried something different, right?
They in Shelter Island and the village of North Haven, they use the 4-poster method along with deer culling
Culling,
as
yeah.
well.
Right.
And you know, they have some interesting ways of measuring deer and ticks on Shelter Island. You know, and disease. They measure the amount of doxycycline sold, which is a treatment
Right.
for Lyme's disease.
That's right.
They measure deer strikes on cars. They measure how many deer are taken by hunters. And they also measure the amount of corn in their 4-poster system. Now, I should explain that a little
Yeah,
bit.
please.
The 4-poster system is it's a plastic apparatus, and what we do is essentially feed the deer with corn. And in order for the deer to get the corn, they have to put their head inside a treatment, like kind of rollers, that puts permethrin on them.
So as they're reaching in.
Right.
Well,
They get
They get-
treated
they get
with.
When
treated.
their head is reaching in,
Right.
they're passing a giant paint roller, basically.
That's right.
Exactly.
That's going to roll a insecticide onto their fur.
Mhm.
Okay.
And village officials from Saltaire, they believe that it has been effective in reducing the tick population.
Because of initially, from what I understood from the meeting, that the deer population went down, and so did the incidence of doxycycline or whatever. But
Mhm.
then there's a little irony in there that we're trying to get rid of the deer, but we're feeding them X amount, whatever pounds
Right.
of corn.
Well, what about
And
the
so-
rodents, too? I would think that they would jump right in there and eat all that corn, too.
They do.
Rats. and
Raccoons,
mice,
they get in there, and they too
squirrels
get
and-
treated. That's something
Yeah.
that.
Well, they might miss the rollers. I don't
Right, well,
know.
they climb on them, and, you know,
Right, I
and
see.
it doesn't matter
They go
where you
everywhere.
get it. So those essentially treat the tick population, and the idea is to rob the tick population from the large blood meal in their 3rd stage so that the population will crash over a number of years.
So that may be an effective strategy for Shelter Island.
Mm-hmm.
I don't know if that, the 4-poster, and maybe for North Haven, but do you have a controlled population? Those, you know, that's an island, obviously, Shelter
Yeah.
Island. North Haven is
Yes.
pretty much like an island, almost,
Yeah.
it's a peninsula.
Peninsula,
Would that work in other areas, the 4-poster system? Where
it-
where you
it
have
hasn't-
migrating deer populations?
The studies are not out there yet.
Right.
Yeah, we don't know.
And they're expensive. You need a certified applicator for a 4-poster system because you are using permethrin. They have to be fenced off so little kids can't get in, but deer can hop over. So they have to be maintained. It's not just purchasing the corn, and then you have to be on this.
And Shelter Island's been doing this for, I think it's 11 years.
Mm-hmm.
So now we don't really know what the effects on the environment are going to be with this much permethrin in
Right,
the
but
environment. So that's another
Seems like
study
you'd have
that
a
needs-
lot of data in terms of Shelter Island, in terms
Yeah.
of if Lyme disease incidence is down. So have we seen it fall by dramatic numbers? Or?
No, not dramatic numbers. Yeah.
I don't think they've I don't think it has fallen.
Yeah.
But I would have to ask that. I don't know that specific question, which really is what we're looking to do. We're trying to lower the incidence of
Sure.
tick-borne diseases,
Well-
not necessarily deer or the mice.
Well, we've
disease.
talked a little bit about Lyme's and the symptoms of it's not Lyme's with an S, it's Lyme disease.
Lyme, yeah.
Lyme
Lyme.
disease.
Yeah, Lyme's is old school.
Right. And Lyme from Lyme, Connecticut, right? Is that where it was
Exactly.
first discovered?
Yes.
Okay, so, but that
Identified.
is not the only tick-borne illness. There's a number of illnesses. So what are some of the other things that people may either be
Well,
aware of or need to be aware of?
I think that they need to be aware of babesiosis, which is carried by the same tick, by the deer tick, and 40% of the people who have Lyme also have babesiosis. And another very important thing to know about babesiosis is that alone takes a different medication than all the other tick diseases, than Lyme, ehrlichiosis, anaplasmosis, Rocky Mountain spotted fever, Miyamotoi. All those other diseases are treatable with doxycycline. And babesiosis is not. It's a parasite. It needs a malaria type of medicine. They used to call it Montauk malaria,
Right.
you know. And it is a combination of a drug called Vepron with azithromycin. So you could go get tested for Lyme, and if they didn't test you for babesiosis, you would, and you may have Lyme, and then you'd be treated, but you wouldn't get better. And so that could be one reason. So I think now out where we are here, most of the doctors test for several of the
Now,
ticks.
are the
If you're going to get
symptoms-
tested, then you get tested for several.
Are the symptoms of babesiosis different than the symptoms for
They're,
Lyme's?
they're similar, a high fever that comes and goes. And actually, one of the problems with babesiosis is some people can be so sick that we even had a death, you know, just from body breakdown because it was such a severe case. But many people don't even know they have it. They don't have any symptoms. And so there's a little bit of a problem with a contaminant in the blood supply because the people don't know they have it
Sure.
and they're giving blood. Now they're just starting to screen for babesiosis in the blood supply. But anyway, so that's a really important thing to understand. If somebody doesn't have, if they don't have any insurance and they can't pay for a test of ehrlichiosis, anaplasmosis, all the others, then what's important for them is to test just for, if you can only test for one more, test for babesiosis because it has a different medication.
So when you said it's a parasite,
Yeah, it's like malaria.
Lyme is a bacteria?
Yeah, it's a bacteria, spirochete.
Okay. Now you mentioned something called ehrlichiosis.
Ehrlichiosis.
That's
And,
different than babesiosis. That's
Different than babesiosis. It's also a bacteria. It is carried by the Lone Star tick. You don't get it from the deer tick.
okay. And what is that? Ehrlichiosis.
It's a bacterial infection, and what is different about it, the incubation period is a little shorter. In 1 to 2 weeks, you will get symptoms. You get very, very sick. What a lot of people with ehrlichiosis seem to have is like intense neck pain. Some of them can't even pick their neck up. They feel like they've been hit by a truck. And the good thing about that is that they go right to the doctor and they get treated doxycycline again,
Sure.
and it works very well for that. Whereas with Lyme, your symptoms could be, you know, kind of, I just don't really feel very well. It's okay, you know.
Right.
Whereas with ehrlichiosis, by and large, not always. And the same thing is true for anaplasmosis, which is another bacterial disease, but that is in the deer tick.
Okay.
So the different tick, all the ticks carry something, but they don't all carry the same thing. So the Lone Star tick carries the ehrlichiosis and also Rocky Mountain spotted fever, as does the dog tick.
No, yeah, it's Rocky Mountain spotted fever. That's one a lot of people have heard of.
Yeah.
So that's, what type of tick carries that?
The Lone Star tick carries it, and also the dog tick. Now, we don't see much of it here. There's a lot more in the south than here.
And that's
But
fairly
there are
treatable, right?
cases,
That's
yeah, it's treatable, but if you get really sick with it, and you have to be very careful. You can't delay treatment with Rocky Mountain spotted fever, as you can attest to.
I had it as a child.
Oh, did you?
I did. And it was
What
bad.
was it? So tell us about it.
My mom saved my life.
And you
Really?
could die from Rocky
Yeah.
Mountain
Way to go,
spotted fever.
Mom.
Yeah, she knew immediately, like something was up with
Wow.
me as a child and brought me to the doctor and got me on,
And you had the classic rash.
Mhm.
Yeah.
On my legs and feet.
Yeah. Yep.
But very high,
Legs and
high
feet,
temperature,
high fever.
High fevers.
nightmares. It really
Did you go to
was-
Southampton Hospital?
Yes.
And they took care of it?
But,
Well, that's,
and I remember it being incredibly bad. So,
And very,
yeah.
very well
It was-
treated should you get it early enough.
Mhm.
Wow.
That's the good news.
Now, what is this new, sort of a newer diagnosis, a allergy to meat that sort of comes on alpha-gal? Is that?
Alpha-gal, they call it alpha-gal for short. It's a very long name that I can't even pronounce. But
Right.
it is the Lone Star tick, all of them, including the larval ticks, can with enough bites, or even with a bite, can sensitize you to red meat. It's a carbohydrate that they have that we don't, we meaning we and apes don't have, but all hooved animals have it. They inject it with you, you develop all sorts of antibodies to it, so that then when you eat the meat, your body has an allergic reaction. And
Describe that reaction.
so you would, okay, they call it midnight anaphylaxis. Anaphylaxis is an allergic reaction that causes your throat to close and could be death. So let's say you're bitten by a tick. It happens pretty quickly. You're bitten by a tick, and then a day or two later, or maybe a week later, you have a meat, 6 o'clock or 10 o'clock or whenever, and then you go to bed, and then you wake up with, rashes all over, and, you feel like your throat's closing and you can't breathe. And then you go to the hospital, and they give you epinephrine and send you home with epinephrine. And they might not even at the hospital know that it has anything to do with the Lone Star tick. And for a long time,
Right.
hospitals didn't know that when these patients were first coming in. It was much more prevalent in the South
Now,
than
do we have
here.
a lot
But in
of,
the last we have more Lone Star ticks here now than deer ticks.
do we
There's
have a
so
lot
many
of cases of alpha-gal?
Well, the doctor that we use, Dr. Erin McGinty, now has close to 400 cases.
Wow.
And she's an allergist, but, obviously.
Now,
there's a
does
lot.
it go away? Or is this,
It, 1 to 2 years, it can go through your system, but the problem is, we're so inundated with Lone Star ticks. If you get bitten again, it starts all over again. So if you live in Nevada, and you come here and you get bitten and you have it, you can go back to Nevada, in 2 years you won't have it anymore. But if you stay here, because the ticks, the
So,
little larval
can
ticks
you,
are so tiny, you don't,
can you avoid getting bit? I know some people
Yeah.
they spray themselves with like deep woods off or whatnot, promoting a particular
Well,
product, but
I
it has
think-
permethrin.
Yeah.
Has DEET,
Permethrin
right,
is
permethrin.
is the best as far as from what my reading for tick prevention. And you can inundate your clothes. You can spray it on your clothes, treat your clothes. When you put it on your skin, it's not that it's so dangerous, but your skin breaks it down, doesn't work very well. So what we encourage people to do is spray their shoes, because that reduces your exposure by 80%. You get your clothes treated. Well, you can treat it yourself or you can send away. And then you put DEET or something on the skin,
Sure.
and I mean, that's if you really, you
Right.
tuck
I don't want people
you
to
tuck
not
this
go,
in your
you know.
socks, and,
I
you
spent
got
a-
a whole hazmat suit, and then you'd be good out in the woods.
I've spent a good part of my adult life trying to preserve woodlands and
Yeah.
create trail linkages, and I hate for people to not go out in the woods.
Yep.
You know,
It's a hard thing because there's so much spraying going on, and people don't feel safe unless they spray. And then on the other side, it's killing a lot of
Sure.
animal life. So
Are there
that's a
risks to-
dilemma. I think people don't know what to do
are there
about
risks
that.
to using those sprays too much in terms of public health? human health?
It depends which ones you're using. Now, permethrin, as I understand it, comes from chrysanthemum with one chemical altered to make it last longer. I mean, you could just have an organic spray with chrysanthemum, whatever it is you put in it, but it doesn't last very long. It lasts a day or
Okay.
two.
The sprays
That's
are,
the problem.
they're highly lethal for marine life if they get there. But
Yeah.
the good thing is that they attach to the soil quite well. So they don't move through the soil very well. But I see, in my own observations, is that a lot of people are spraying. And,
So true.
And
It's so true.
It's really killing not just the
Are they
target
spraying
species.
themselves or they're spraying their
their lawns,
backyards?
right.
Yeah, so that's
Treating
The
their
most
property.
effective thing that you can do to keep ticks off of you is to treat yourself. Is what you said about your
Exactly.
clothes, your shoes. Some people wear long boots, rubber boots, that keeps them down when they're doing their gardening and things like that.
Like when it's 100 degrees out and humid.
They should stay on the trails and don't go into the side areas where they're more likely to
Well,
encounter a tick.
A big problem is the children, and there's the guy who discovered Lyme or whatever was saying in our meeting that, it's a children's disease, because the grown-ups can keep themselves rather protected, but the kids run off into the woods, into the leaf litter, and and so they're a little more apt to be exposed. It's a little harder.
Sure. So, Rebecca, if somebody wants to know more, they have questions, I see you have a helpline.
Yeah.
631-726-TICK.
8425, right.
8425?
Right. And
Okay.
I have a message there. It's a little bit of a tedious message, but it tells you what to do if you have a tick on you, like get it off, immediately. I had one person that had had a tick on them, and they waited 7 hours to go to the ER to have a professional take it out. But you realize the longer the tick's on you, the more likely you're going to get Lyme. They say if it's, less than 24 hours, you're okay. So this person waited all this time because they thought that was the way to do it. And then they
Right,
ended
yeah.
up with a $3,000 bill.
Oh,
too,
boy.
So that was a little
And
bit-
you also
so that's
have-
the kind of thing that I can help people with.
You also have a website, eastendtickresource.org.
Right.
All right, and maybe we could show that on the screen, eastendtickresource.org. And I want to thank you, Rebecca Young, for coming on our
Okay.
show. Tommy John, Councilman Schivoni, thank you.
Supervisor.
And enjoy the woods and enjoy the Hamptons in the spring and summer, but be careful. And if you think you may have the symptoms, make sure you
Give
go
me a
see a
call.
doctor, go see the resource center. Don't take it for granted because you want to treat it early. That is the key. You want to get to it quick and not let it go to late stage, which can be very debilitating and very serious. So, all right, we'll see you next time on Talk of the Town.